you mentioned a story, and you sort of like you kind of gave a few details,
Oh
but I'd
yeah,
like to hear you the whole thing, because I think
yeah,
you put an email somewhere, but I that probably didn't come to me. I want to hear this story about this woman who came in and basically, had been kind of, shoved over here, over there, and you found what was it? Myocarditis in her.
yeah,
Can you tell that story like from the beginning?
yeah. I can give you the full story.
That'd be great.
So I'm working in this place in Allegan, and this doesn't matter to anybody but me, but it's like the end of my shift. And so I'll just give you a dirty little secret about medicine. You don't want to be a patient that walks into the ER at the end of an ER doctor's shift. That's just the way it is. Hopefully the ER we're going to walk into has the shift staggered in such a way that while it might be the end of someone's shift, it's the middle and the beginning of someone else's shift. And that person will be your doctor. But at these small places, you're in. And so it's like 6:30. I'm done at 7. And like this lady rolls in, and one of these old nurses is like, you just don't bother, like save that for the next time. And so they're hooking her up to the monitor, and I'm looking at the monitor, and her heart rate's like 130. And she's only 34 years old. And so I'm like, I can't let this one sit. So I knew her chief complaint from triage was that she was short of breath. And so I looked at the rest of her vitals, and they were all bad. Like her heart rate was through the roof. Her respiratory rate was like 30, 40. Her oxygen was borderline. So I just grabbed the machine, walk in the room, and it's a 34-year-old, like very previously healthy person. Sometimes you'll be 34, but you're physically.
When you say machine, you grab the Kosmos, right?
Yes.
Okay, great.
So at Allegan, if I see like a chief complaint of shortness of breath or chest pain, I just grab the machine and walk in there. There's no like, go assess the patient, do my William Osler physical exam, and come back and get the machine. It's just bring the machine in there. Don't waste your time.
And it's easy enough, right? It's not like it's heavy or difficult to get from one place to the other.
Not at all. And actually, just backing up, before I had the machine, I had started working there in 2019. So it was a couple months, and then I had the machine. But in those few months, they had this like beast of a machine in a closet that no one used. And so I busted it out of the closet, and the nurses were like, what's that? Like, we haven't seen that used in years. And so that was so unwieldy that you would go see a patient and then make a decision if you needed to go get that. Was it worth your time to go get this? Whereas it's always worth your time to bring in something that's basically this with a probe attached to it.
Right.
So I go in there, and she's 34. She's no medical problems, on no meds. She's healthy. And she's like swollen, like you wouldn't believe. Like her legs are swollen, her abdomen's distended. I mean, she could pass for pregnant if she was in an OB clinic. And she's breathing real rapid and shallow. And so she told me that she had COVID in November. And it was a pretty uncomplicated course. She had been vaccinated and had a breakthrough infection in November. She hadn't gotten a booster, but she recovered within days. And it was really just sort of cold flu-like symptoms. And then at some point about a month later, towards the end of December, she started just noticing being tired and being short of breath. And then progressively her legs were getting swollen. And this played out over about 2 or 3 weeks. And then this was on a Sunday. No, this was on a Saturday. So on the Thursday of that week, she said, this is too much. So she went to an urgent care, and it's a town called Gobles. It's a small town, not too far from there. And I've had patients come from there before. And so she said she went to the urgent care, and they did some blood work. They didn't really tell her what was going on. At least she didn't have like an impression of what their opinion of her was. Just that they were worried. So they ordered some blood tests, and she came to Allegan that same day on Thursday to get the blood drawn and to get an x-ray of her abdomen. But fortunately enough, the abdominal x-ray series includes a chest x-ray. So that got done on Thursday. And then on Friday, someone from that urgent care called her and said, so the x-ray showed that your heart is very enlarged. Here, we're sending a prescription to your pharmacy. It's for Lasix. We want you to start taking it. And then if you can, try to make an appointment for an outpatient echo where you live, which was near Allegan, next week. Because by this point, it's Friday. and there's no chance she's going to get that done. Little did she know, we didn't even have an echo tech at Allegan to do the echo that they wanted her to have as an outpatient anyway. So by Saturday, she had gotten the Lasix filled and took 2 of them and felt worse. And so she just decided, well, I should just go to the ER at Allegan rather than, wait till next week for testing. So I hear this and I'm like, okay, grab the probe, and within, like, her lungs are just full of fluid. She's just got pulmonary edema and fluid all over her lungs. And I look at her heart, and her heart is like severely dilated. All 4 chambers of her heart are severely dilated. Her ejection fraction's 10 to 20%. She actually had a clot in her left ventricle. So this like condition that she had been at play for weeks. It takes weeks to months to develop a clot. Like, wow. if I just took somebody and artificially destroyed their ejection fraction from 60 to 10% today, they wouldn't form a clot for a couple weeks. They might not form a clot, but if you were to form a clot, that process takes a couple weeks. So it's now like 6:45. Like, that was all that information was figured out in about 15 minutes.
Wow.
And so at this point, I believe I have the answer, right? This lady's got a cardiomyopathy, probably post-COVID myocarditis. She's got a clot in her left ventricle. So she needs to be, diuresed. She needs to be treated with diuretics. She needs to be treated with anticoagulation or blood thinners. And she needs to get the hell out of Allegan. Like, she needs to be transferred to Kalamazoo or Grand Rapids, like, as soon as possible, like, as a priority transfer. So my relief shows up around 6:50 as I'm kind of, ordering her stuff and kind of setting the stage for what he's going to have to do, because he'll have to work on the transfer, because they won't accept a transfer until they get a COVID test and all the different test results are back. So he's going to have to work on the transfer on his shift. So I explain all this to him, and he's like open mouth, like, what are you talking about? Like, how do you know all this? And he doesn't really know me. Like, I haven't crossed his path yet in Allegan. So I showed him the pictures on the machine. Here you go. He's like, well, I'm not real great at ultrasound, but that looks pretty awful. And I was like, I am pretty good at ultrasound, and it is pretty awful. So I leave, and then the next day I show up, and he's like, man, you wouldn't believe she went straight to the cath lab at, I think she went to Borges and Kalamazoo, because her lab tests were all kinds of terrible. And so he was able to sell the case, and I actually was able to upload a picture of the clot.
Oh, wow.
I actually just took a picture on my phone of it. And then they have like a digital photography, like, portal that you can take pictures of wounds. Usually it's for wounds, right? And so I took a picture of it with that camera from my phone and was able to put it into her chart. And, he's like, they accepted her right away. She was out of here within the hour. And the thing that I thought was sort of like cute and speaks to just like the novelness of this and the disruptive nature of it. He was so astonished. He went to see the patient and saw how swollen her belly and her legs were that he thought I might be missing liver failure. He's like, well, she drinks, maybe she has cirrhosis and liver failure. So he ordered like a head to toe CT, which was like all normal, essentially, like, liver normal, kidneys normal, fluid all over the lungs.
So it was just this.
Dilated. Yeah, just confirmed exactly what we had figured out, like, right away. And so if she undergoes like the typical Allegan testing pathway, she probably ends up staying in Allegan, where we have really no manner to treat her. She's now like a complex, sick cardiovascular patient, and they have no manner to treat her. She probably stays there for a day or two, maybe longer. Maybe it happens quick and she gets lucky, but like the added information from being able to use the ultrasound and figure all of this out right away was really what pushed her over the edge to get her to definitive care quickly. Because we have patients that will sit there, for days, and the sign out from doc to doc is like, yep, this one's accepted to Borges, but there's no bed, so we're sitting on her. This one's accepted to Spectrum in Grand Rapids, there's no beds, we're sitting on her. And so they were able to prioritize this transfer because of the information that we acquired from the Kosmos. And so I haven't gone, my next shift at Allergan's next week, so I'm going to find out, you know, what happened to her after the fact. But I suspect we avoided a very, very bad outcome. I mean, I think the most important thing in avoiding a very, very bad outcome was her showing up at the hospital. But next was being able to use the ultrasound to kind of crack the case open right off the jump, so that, you know,
and get her up, moved
were
up
on the
that
table
list
for
to get her
everyone
the.
see, so we could get her treatment. Exactly.